And I think we are up and running. So just because technology is very glitchy, it's important to know that if you have trouble at all throughout today's presentation with the audio, down next to the chat box at the bottom of your screen, all the way over to the left, there's like a little audio phone, and that allows you to toggle back and forth between the conference call that you can join from your phone or using your computer. So our best advice is to, if you're using one, switch to the other, and if that doesn't work, log out and log back in. This is recorded, and I believe we will be sending out a summary or at least the highlights. So if you miss and you can't get back in, don't worry, we have your back. Next slide. So we will be using the chat box, and you can turn that on by toggling down below. And it turns it on and off, and that's the primary way we're going to be communicating with you all. Your questions in there. We have people that are monitoring that. Anything we're not able to answer today, we usually try to follow up, find the answer, and post it in our slack.com channel. I'm sure we'll slack.com channel link in. If you're not already signed up in there, please join. I will say that I downloaded the app and am so I don't know, inspired by the way that people are using it. I know it's a little hard to add another app in your life, but there's so much communication in there and people are answering each other's questions, so I highly recommend it if you're not already in there already. All right, next slide. Thanks, and we just posted the Slack channel link in our in the chat box. So I will say that all Chicago's COVID-19 response is ever evolving, but we try to keep it in at least these primary bucket areas here. So we have a goal to promote cross-provider communication. We are securing financial resources and helping steer and direct and prioritize those as much as possible to you all, since we know you're on the front lines, and we're distilling guidance from sources and trying to put that in Slack or put that on our webinar. So these are the things that we're focused on. Of course, if you have other ideas about things that we are doing, please reach out to us or put it in the chat box. Next slide. Our agenda today is up on the screen here. So we're going to hear some updates from our partners. Stephanie Seidman from CSH is going to talk more about coordinated entry, and Mary Trujillo from the Chicago Coalition for the Homeless has some advocacy items she'd like to share. We'll move into new resources and talk about our agency emergency fund, then some overall updates on COVID-19. Of course, you all probably know a lot of the updates as well, and so we'll be asking you to put things that you know about in the chat box. And then if we have as much time as we have, we'll take questions and answer at the end and talk about any next steps that we have. Next slide. Great. And so, Stephanie, I'm going to unmute you on your phone line, and we can go forward to the next slide.
Thank you, Nicole. Can you hear me?
We can.
Oh, great. Thank you so much. Wonderful. Hi, this is Stephanie from CSH. It's good to be in community with all of you. You may remember from last week that we have suspended housing assessments until April 1st, which is Wednesday. And if you weren't on the call last week, just a very brief explanation is that a few of our access points needed to close their doors, and we were really just looking for an explanation or something to offer that would be easy to understand and consistent so that people experiencing homelessness didn't travel from one location to another or just travel at all unnecessarily during that time. So we determined that we would just suspend assessments till Wednesday, April 1st and prepare for that, and that's coming. And we are asking everybody who serves as a skilled assessor, if you have capacity, to please start again with assessments on the 1st. If you don't, we certainly understand, and veterans are more than welcome, if they're in touch with an assessor who's busy, or just if they're not in touch with an assessor, to call the VA Community Resource and Referral Center to complete an assessment over the phone. The VA CRRC is not turning anyone away in person, though they're asking if at all possible, for people to call. Next slide. All of our access points are moving into a virtual reality, and so we're asking people not to send anyone to a physical access point for the purpose of completing a standardized housing assessment. I want to mention a little bit about what that means, because lots of players are in a double duty sort of scenario. So as an example, Featherfist is open, and they are also an access point. So this is not my way of suggesting that people should not go to Featherfist because people walk in their door every day and are served, but just to say that we're asking people not to direct people facing homelessness who all they need is a housing assessment to go to a physical location if that's the one thing they need. Instead, the direction will be to simply call, if at all possible, and do this over the phone. And we'll have the next slide share a bit more so we can move there. Thanks for switching that slide, if you can. If you're not able to switch that slide, I'll just mention that it discusses the call center, and I can put more information in the chat. Oh, thank you so much. But essentially, the phone number is listed here at 312-361-1707. The Coordinated Entry Call Center is typically staffed by 2 dedicated assessors at Catholic Charities, and starting April 1st, it will be staffed by a larger number of people who are dedicated assessors. Thank you so much, Heartland. Thank you, Facing Forward. And the idea is that anyone at all without a staff member, just on their own, is very welcome to call in either for an update or an assessment. The hours are Monday through Friday, 8:30 to 4. And during high call times, the listener will hear a message every 30 seconds that offers additional phone numbers of assessors who are available that day to call that day. If someone is to hang up from the call center because there are quite a lot of calls, and let's say, for example, calls an assessor Facing Forward, if that assessor is currently on the phone, the caller will hear a message inviting them to leave their information to be reached out to back, so that the assessor can just get back to them right away to complete that assessment over the phone. And I'm mentioning this because we're a little unclear of what call volume will look like, but we have some additional people helping to staff the call center so that we can be operational by Wednesday. If you have staff who are suddenly remote and have additional capacity, and they are or they ever were an assessor or even not, but you have some additional capacity and you want to pitch in, please feel free to reach out. It could be in the chat box. The next slide will have emails. And so we could go to that slide. Ben Darby is with the Center for Housing and Health. He works with assessments. I'm noticing a fun N in there. It'll be a mystery guess as to what that was for. So you could reach out to Ben, you could reach out to me, you could put it in the chat. We are not suggesting you have any extra capacity whatsoever, but if there is someone with extra capacity, we'd be happy to be in touch as to how to utilize that person's time and talent. And these are all of the contact folk we want to just make you aware of. If you have a question or a feedback or a follow-up related to coordinated entry, I mentioned last week that we didn't slow down with matching. Nothing else has changed other than assessments. So just wanted to be sure to catch everyone up on what is now happening with assessments moving forward. Thanks for the opportunity.
Great, thank you.
And then I'll just say it I'm so sorry, I just saw it very quickly and then I'll stop talking. But I would want everyone to know that we don't require anyone to do an update. There is no penalty for folks who don't do an update. No one is being deactivated during this time. And simply am mentioning that people can call to offer an update if they have one and they have access to a phone, and didn't mean to suggest it was required. So just wanted to say that really quickly. Okay, I'll stop now. Thank you.
Thanks, Stephanie. Great, thank you. And I know we're going to get some updates from Mary. And Mary, I can't find you in the participant list to unmute you. So if you want to unmute yourself and then...
Can you hear me?
Yeah, now we can hear you.
Oh,
great.
great.
Hi.
Hi. Okay, everyone. I just wanted to provide an update and a heads up that we will be asking for your advocacy very soon. So the update is that we have an ask into the state for $40 million for additional isolation housing and shelter decompression. We are also going to be making an ask around homelessness prevention. We had originally put out $40 million as the ask, which would be quadrupling the fund, but now we're actually looking at data from the last week, which we just heard that there were 27 calls just to the city for rental assistance. So we're going to be looking at comparing that number to last year to see how much more that was. Obviously, request for rental assistance doesn't mean that you're eligible for homelessness prevention. So we just need to sort through the data to see what an adequate ask would look like, to see if $40 million would even cover what we're anticipating the need will be. So we're looking at how the money coming down from the feds could be applied to these asks, but we will still need the state to agree to dedicate this money for these purposes. So when we have the final homelessness prevention number, we will be asking you to contact your state legislators to support these asks. We would get you language, explaining exactly what you would be saying to them or how you could be contacting them, and also that you could then share it with your networks. I'm thinking that maybe distributing this information over Slack would be the best way, or I'll talk to Nicole about what she thinks is the best way to get this information to all of you. That's the update for this week.
Great. Thank you, Mary.
Thank you.
All right, let's move on to the next slide. And Margaret, let me find you, Margaret, in the chat box, or if you can access.
I think I just unmuted myself.
Perfect. Okay, great.
Okay, great. So we wanted to share some information about a new fund that All Chicago established. We're calling it the Chicago COVID-19 Homeless System Agency Emergency Fund. So just a brief overview of this fund before we get into some of the nitty-gritty. So the goals of this fund are to support homeless service agencies as they're responding to the COVID-19 crisis and try and evolve with the needs of agencies as they're responding. In doing this, we want to support prevention and spread of COVID-19 among staff and those who are receiving services. And in doing this, ultimately keep the homeless system open and in operation during this time. So just a couple other things about this fund. So there are two funding sources that are providing funds for this fund. So both funds are being provided both through philanthropic partners, so private funding, and the Illinois Department of Human Services, so state funding. So the state funding is $3 million. So that's $3 million out of the $6 million that IDHS is providing statewide. So $3 million is going to the Chicago COC, and private funding is accounting for around $500,000, but it is increasing. This fund is meant to be unrestricted and flexible. We want it to be as flexible as possible in order to respond as well as possible to the needs that agencies are facing. We plan to provide funds directly to agencies electronically to make sure that agencies are able to obtain these funds as quickly and easily as possible. The application is very low barrier. It should be an easy application to complete with only a few questions and a budget worksheet. And we plan to have multiple application rounds for this fund. So I'll talk in a couple minutes about the first round that we're going to have, but we'll be sharing more information about upcoming rounds as that comes up. Next slide, please. So I want to share some information about the eligibility requirements for this agency emergency fund. So we're looking to provide funds to nonprofit agencies in Chicago who have a track record of robust programming and services for Chicago residents. And the fund expects that agencies are operating one of the program types that are listed in Chicago's DOC written standards. So by that, we're talking about either an emergency shelter, transitional housing, street outreach, standalone support or a drop-in center, permanent supportive housing, rapid rehousing, joint transitional housing and rapid rehousing, or a safe haven, or multiple of those. Next slide, please. So the eligible costs for this fund are falling along five large categories. But I do want to say kind of off the bat that we do have this other category. So if there are major needs that your agency has that don't seem to exactly fit alongside or within any of these first four categories, please go ahead and submit an application for those funds that are needed under other. So in terms of staffing costs, eligible staffing costs, what we're thinking about is if agencies are needing costs related to hazard pay or overtime pay, so for example, paying staff a higher wage to encourage them to come to work, or paying for new staff to do work that is ordinarily completed by volunteers that are no longer able to volunteer. It would also cover expanded sick pay, as well as expanded outreach services to unsheltered individuals. And as far as food and supply costs, basically an increased cost that your agency is having to secure food or supplies, or any additional supplies that are needed. For example, or maybe hiring a cleaning crew if that's necessary, or purchasing dividers to help separate participants in shelter situations. As far as temporary housing, we're specifically thinking about temporary housing to effectively respond to COVID-19, so such as relocating individuals who have been exposed to COVID-19 from a shelter to a hotel or a motel in order for them to quarantine or self-isolate. And then the fourth category is facility modification and expansion. And that is essentially referring to costs that are necessary to equip or furnish alternative facilities or areas within existing facilities that aren't normally designed for shelter space, so that they can be used to provide accommodations to that allow social distancing. And also any expenses related to ensuring that facilities are accessible and ADA compliant. And then, so if there are other examples that fit along these categories, definitely we would want you to submit an application and explain those needs. We want this to be as flexible as possible to be able to respond to the needs of agencies. Next slide, please. So as far as the application timeline is concerned, it is a pretty quick turnaround for this first round. So round one applications are due this Friday, April 3rd at 5 p.m. All Chicago will provide funding notifications by the week of April 13th. We're asking for one application per agency per application round. And the application is available on Survey Gizmo. So there are basic questions to verify eligibility of the agency, And there's a simple budget worksheet that would need to be completed and uploaded into Survey Gizmo. And the link to the application, as well as additional information about the fund, is available on the All Chicago website, and we'll be sure to place the link in the chat box. So I think that's all I've got for now.
We do have one question from the chat box. It says, does the fund eligibility extend itself to residential treatment centers?
Yeah, so at this time, the fund eligibility is really, it's limited to agencies that provide a funding program type that is listed in our continuum of care written standards. So that would be one of those program types that was listed in the a couple of slides back. So I can go ahead and go through those again. So emergency shelter, transitional housing, street outreach, standalone support or drop-in center, permanent supportive housing, rapid rehousing, joint transitional housing and rapid rehousing, and safe haven.
Thanks. And Margaret, I'll just add too that if an agency feels like now they are sort of operating differently and maybe they weren't classified as one of those program types, but now because of COVID you are serving people who are now experiencing homelessness or differently, and you feel like you could match under one of those program models, you know, all of that information is on the application. But I would say go ahead and feel comfortable submitting and let our advisory group that's helping make these decisions sort of sort through that. So I think we want to cast a wide net when it comes to need. And so use those as guidelines, I would say. But if you have questions, definitely we can talk you through it, or just go ahead and submit, and we'd be happy to provide feedback if it's determined that you don't meet the eligibility requirements. And then I will say that obviously we are seeking additional funding for this emergency fund, and hopefully it will continue to increase, but we are fully expecting that the submissions and the requests that are going to come in are more than what we will be able to fund. So that's why we do have an advisory group helping us make priorities, make prioritized decisions, so we'll keep you posted on any additional funding that we get, and that's why we're doing it in rounds. So we're communicating most of this information in Slack, but also when we open up a round, it goes out to an email pretty broadly to Continuum of Care, and we can put the link in our chat box for how to sign up for our newsletters if you're not already receiving those announcements. Great. Melanie, any other questions about that we should address right now?
Yes, there's one more. It says, do we submit multiple budgets for different program models? The budget form has a drop-down menu for program type, and only one can be selected.
Yeah, I can respond to that question. So we've actually updated the budget form to allow checkboxes instead of a drop-down. So at this point, if you click the budget form link that's available in the fund materials on our website, you should be able to be navigated to a budget form that provides checkboxes rather than a drop-down, so that you can select multiple ones.
Great. Great. So keep putting the questions that you have in the chat box, and we'll do our best to answer them either at the end, or I'm sure there'll be some sort of guidance that we either update or send to everybody after the fact. Okay. Great. So I'm going to give a few updates that we know were probably questions from the last webinar that we can now answer, and or just general updates about the shelter system. And so Denise, if you want to go to the next slide. So one of the questions that we have been frequently asked on Slack and on webinars is how to access those hotel beds that the city frequently refers to. And so the guidance that has come out about this is that the hotel beds are exclusively for people who are referred basically from their hospital or a medical provider if they're awaiting test results and do not have an isolation place to wait, or they've tested positive and only have mild symptoms, and so they're not needing to stay in a hospital, but they don't have an isolated location to stay. So the good thing is that for any of the people who are experiencing homelessness and they go to a hospital or talk to their medical provider and need to be quarantined, there is a place for them. But I know this means that for many of us who thought that the hotel beds were maybe a solution to help decompress the shelters, where we could, as homeless service providers, maybe refer directly into hotel beds, the process is looking a little bit differently. And so this is the guidance we've received. And if people have questions or other thoughts about how they're seeing it work on the ground, please put that in the chat box, because we know a lot of you know this already and are operating in this reality and might have additional tidbits or information about that. Next slide. Great. So there was a short period where there was some confusion about where and how people refer to these new shelters. So the 311 process for shelters has reopened. The majority of the new referrals are being routed to the new temporary shelter facilities, and the process for accessing shelter is that people should call 311 from any address. We do know that hospitals and police stations are not allowing people to sort of go in there and use their phone and just kind of wait for a pickup. So unfortunately, I would love to hear from some of you all about how you're helping participants work through this. If you're hearing any issues about this and if you have ideas for what we should be advocating for, please put that in the chat box. We do know there's 400 additional beds for shelters that are being available through the various YMCA locations that are being operated by, some are being operated by our existing shelter providers, and the other ones are just coming online now. And then CDPH is providing shelters with a medical consult by phone. So each shelter should have received a number to call to determine whether they should separate a person or whether the person should go to a healthcare system. And all of this information can be, Denise, if you want to go to the next slide, all of the information about this can be reviewed more thoroughly by the on the chicago.gov/coronavirus website. So there's a whole document called Guidance for Homeless Shelters and also a triage tool or a health screening tool that shelters or other providers can be using if you don't already have one that you've created already. I'm going to pause there because I saw that there is a lot of chatter in the chat box, which is great. Melanie, are you able to raise up any questions right now that you think we should address, or should we hold them till later?
I see one. It says for the emergency hotels, are individuals with mental health and substance use disorders still not qualify?
That's a great question. I don't have the answer, but somebody else on the call might. So if you know the answer to that question, go ahead and put it in the chat. If not, we can do our best to, once we know the answer, post that in Slack. Okay, so we'll keep looking through those questions to pull out ones that we think we know the answers to. I think all of you know that a lot of times when we share information, it leaves us with more questions than we're able to answer, and that is just the nature of this crisis that we're dealing with. But the important thing about encouraging you all to ask these questions either on our webinar, in our chat, or in Slack is so that we can raise them up to the people who know the answers and influence the guidance that is then created for us. So we appreciate that. Okay, we'll move on to the next slide, and I'm going to turn it over to Max, who can talk about our plan and helping redeploy staff to shelters.
Hi, everyone. Thanks, Nicole. This is Max Burns from Old Chicago. Sorry. So as mentioned, as Nicole mentioned in the last slide, these 400 new shelter beds that are coming online, the YMCA network, the city and all Chicago are kind of coordinating the process to identify staff to redirect or redeploy to those shelters. So I think it was late yesterday or over the weekend at some point, delegate agencies of DFSS received an email announcing this process and providing 2 links that we will share in the chat here momentarily. One of the links is the actual application or form to, identify that you can, or people who can, people who can volunteer or staff these shelters. So the first, and Jennifer just posted them, the first one is the actual form itself, and the second are the position descriptions. There are 4 positions. One is like a manager of a shelter, another is a supervisor for a shift, and then they're looking for individuals who can kind of aid the shelter in tasks, and then finally like a security position. People can view those and then fill out the form and identify when they're able to help or what positions they feel most qualified to help with. And we will also be posting this information later today in our Slack channel on both links. That is kind of the process. We're going to be training the different agencies that are managing those shelters on this process to kind of find, as people apply, they're going to reach out and conduct the kind of interviews and screenings, and we're going to be providing support on that. But we're getting that rolled out, early this week, and hopefully we'll be making some calls to folks later this week as our plan. But we're trying to get this going as fast as we can to get those shelters online to get people housed.
Great, thanks, Max. And Denise, if you want to go forward a slide, I just want to say one thing about our census work, and then Max is going to turn it over just for a brief update on what homeless service providers can be doing now. So as some of you might know, All Chicago partnered with the YWCA, who received a grant from the state to help raise awareness among the population of people experiencing homelessness about the census to encourage a complete count. And because we are focusing a lot of energy and resources toward COVID, and because some of the census processes have been pushed back, we are taking a little break from our census work, and we feel comfortable doing that especially because other partners like the Chicago Coalition is really working on similar efforts. And so we're going to be connecting with them to see how we can support, but also want to let you know a little bit about the overall process, because it's important that we do, if your agency has capacity, that you're still able to connect with people, especially those in PSH, to ensure that they're being counted. And I'll stop there because I know, Max, you might talk through some of that, but I will put a link to the Chicago Coalition's census page. People can bookmark it there. They have a lot of great resources. We frequently used their resources even for our own work. So Max, do you want to say a little more?
Yeah, so the 2 processes that we're going to be used, or that are going to be used by the U.S. Census Bureau to interact with the folks that we serve, folks who are either maybe in site-based projects, so shelters or transitional housing, or individuals who are experiencing unsheltered homelessness, would be kind of incorporated and counted through these 2 processes, the site-based enumeration and the targeted non-sheltered outdoor location counter. It looks like a pit count, effectively. Both of those processes have been pushed back 1 month, and that was announced in a memo that was released early last week, the weekend just before that. And so tentatively the dates, the U.S. Census Bureau says that the dates for the site-based enumeration will be April 29th through May 1st, and that the TENSOL, or the kind of pit count for the census, will take place on the night of March 31st. For the most up-to-date information about census work, you should definitely consult the census.gov, as well as pay attention to the information put out by the coalition. So that's kind of the lay of the land for that, but it could, they're going to have more information as they get closer to the date of. So thank you.
Great, thanks. And if anyone has any tips or ideas about what your agency is doing to continue census-related work, even amidst the current situation that we're in, please put those in the chat box. We'd love to hear from you, and as your partners would too, or your other peers. Okay, Denise, let's move on to the next slide. I think this is Karen.
Hi everyone, this is Karen from All Chicago. I'm happy to be back with you again today. I'm just giving a brief update from something I announced last week for housing providers. So last week I announced we were working on some interim guidance to assist housing providers in housing people and continuing to provide services. We uploaded those documents to our website late last week. Again, they're a little focused to those who receive HUD funding, but I think the record-keeping guidance is actually quite helpful for anyone during an emergency situation. So hopefully, you all have an emergency plan and you've implemented that plan and those policies. And so the two interim guidance pieces we put up are a record-keeping standard. So how do you keep records during an emergency situation? And this can be all different kinds of records. It can be IDs, it can be housing inspections, it can be service plans. So it gives a lot of guidance there. There's also a template attached to that one that you can utilize. And then there's also guidance on actually conducting housing inspections and how that works. So those are two separate documents that we put on our website. They are on the All Chicago's COVID coronavirus page, and if you scroll about a third of the way down, you'll see them under the section entitled Housing Providers and Other Agencies Guidance. I will say they are both labeled interim because we did work with the local HUD office to craft this, so thank you, local HUD office, for helping with this. But if HUD releases other guidance because of the COVID-19 health crisis, that guidance would, of course, supersede what we're giving you. So again, both of those documents are on our website, and we will talk about them more in depth on Thursday. And if you can go to the next slide. Thursday, we're happy to announce we're going to do our first weekly webinar. We're calling it the Housing Provider Sharing and Problem Solving Session. So again, this is focused on those of us in our community providing housing, permanent supportive housing, rapid rehousing, transitional housing, and talking through some of the challenges you're seeing and trying to share how some of you have solved these problems and maybe think of the things we don't have answers to and how we can get solutions so people can keep moving forward with housing people and keeping people housed. So we're going to do that on Thursday from 2:30 to 3:30, and Jennifer just popped the webinar registration in the chat box. Again, this is a dedicated time for housing providers. We're going to talk about housing, not necessarily shelter, not necessarily drop-in, but actual housing provider challenges, and we hope to really work towards some common solutions and best practices. So this Thursday, I do plan to go into depth about those two documents that I just mentioned. So hopefully that will be helpful to many of you. And then we're going to start crafting what we think the topic should be for the next couple weeks. And we'll keep doing this until until this health crisis ends and we don't need to do this problem-solving session anymore. And so we'll generate new topics through that. We've already heard a lot of different ideas about that, like telecase management, and I think there's different training things that people are looking for, and so we'll try to craft where we're going to go next together. So Betsy just asked whether we envision the webinar to be policy-based or service-based. I mean, I hope it's going to be a little bit of both. So it is going to be kind of an open forum. So these first few things that we release as interim guidance are certainly policy-based questions, but I think there's very real service questions that we've heard people ask, and I think some intentional sharing about that and how you're delivering services is really important. Okay, I mean, that's all I have. I see a great suggestion from another provider, so happy to see that.
Great. Thank you so much for all the questions that you're submitting. Melanie, I'll turn it over to you to see if you have other questions that you feel like we can answer or anything else that you want to call out in the chat box.
Not at this time.
Great. And I know Betsy is calling out the CSH resource, which is, I love the guidance that they published. And Betsy, maybe we can put the link in the chat. Maybe I can grab it so that people can get directed right there. Does anybody else, while people are still submitting questions, any of the other facilitators have things that they maybe answered in the chat box that they want to call out and answer verbally? I know it's hard as a participant to be following all of this too. So if there was an answer that you feel like might be applicable, feel free to unmute yourself and answer it.
Hey, Nicole, can I say something? Oops, sorry. So I think someone asked for like where the actual application is, or the form is to sign up to redeploy staff or to volunteer for yourself. We really encourage you to send those directly to your staff or to email them. Really trying to take like a focused approach to find folks who are social, skilled social workers with professional experience working with vulnerable populations, to truly get some targeted, assistance in helping those individuals in those shelters. So just a quick update about that, a reminder about that.
Great, thanks. And Ileana, I saw you ask the question about whether the COC can help with any personal protective equipment. It's honestly the amount of time that we as staff have spent trying to figure out how do we help with PPE is overwhelming, because we have this question at least 100 times a day. We know it is one of the biggest and critical needs, and we are working with a lot of different people who are already on that case, so we're not trying to create yet another sort of like survey or another channel where we can help do that ourselves, but we are trying to amplify any messaging around this and try to, once we hear that there is a stash available and how to access that, we will certainly share that. I do know that we may be surveying shelter providers additionally for their needs. DFSS has submitted a list to CDPH. I know there's at least 2 other nonprofits that are coordinating an effort for this. And so to the extent possible that we're able to direct people towards where they can access those resources, once we know that, we will try our best. I will say, I feel like maybe we should create a separate channel in Slack that's just dedicated to PPE. So we can think about that. Maybe we already did that. Haven't been in there today. But this is one of the most common questions that we hear, and unfortunately one of those that I just don't have a good answer for. If other people have suggestions or recommendations, please put those in the chat box. Does anybody know the answer to Alexa's question about calling 311? I know Karen said we'll take a look at it, but if you call 311, is transportation being provided currently? I think the answer is yes, but I can't speak to how it's actually being operationalized on the ground. I think the intent is yes. Okay, so we'll do some digging there. Andrew asked a great question about whether essential workers have priority access to COVID-19 testing. Andrew, the answer to that is yes. I think the question is what is considered an essential worker. And so I know at least early on last week, we had gotten confirmation that shelter workers were not considered essential workers and so therefore did not have that priority access to COVID-19 testing. That might be changing at the hospital level. We can try to do some more digging and find out if there's an advocacy angle for there too. I know my colleague Beth Horowitz is in constant communication with the hospitals at this point. Michelle, the answer to your question about the Chicago Community Trust allotment, I believe the answer is yes. There's honestly so much funding going around that I just want to confirm that, and if there's a reason you're asking or how that would, if my answer is yes versus no, if there's another question about that, please let me know. Oh, I see, Michelle. Thank you. Let me get back to you on that. I think I was thinking about, so we have various emergency funds going on right now, one for students, one for agencies, and one for our general flexible emergency funds for client assistance. And we also are hoping to have an increase in state homeless prevention funds. So I don't know if I can answer your question directly yet.
There's another question, Nicole. Let's see. I can get back. Will you be giving the dates for the subsequent application rounds?
So this is Margaret. I can answer that. Yes, we will share those dates for subsequent application rounds for the agency emergency fund as soon as those become established. So for sure, we'll be wanting to communicate those as soon as possible. I also wanted to bring to the surface a couple of the other questions that were asked in the chat box. I know there were a lot of questions that were kind of going around directly after the discussion about the agency emergency fund. So I just want to clarify that agencies should submit their increased operational expenses related to the agency emergency fund that were incurred during the time period of March 16th through April 30th. And I also want to clarify that the agency emergency fund should be applied for on behalf of the entire agency. So one agency would submit one application per round.
I don't know if anyone has the answer to this, but a question was posed: does the city have a plan to attain more beds for the homeless other than the 400 at the YMCA?
This is Nicole. I don't think we know the exact answer to that. I do know that the city is trying to be as responsive as possible to the idea of creating social distancing in the shelters, and so my guess is they might still be trying to analyze the need in some of our other shelter locations, especially those that aren't city delegate agencies like PGM and some of the other smaller agencies that don't get city funding. And so they may feel like there is still a need to open up additional shelters as they get working with beyond their delegate agencies. Leo, would you mind sharing more information about your comment that says people should be able to call 311 for clients needing shelter, but how that's playing out might be different? If you have like an anecdote or other information, that would be helpful.
This is another question in the chat box. I was told by a police officer that clients can no longer sit at a police station or the hospitals. Where are the clients to go?
That's a great question, and I'm not sure if anybody else who was on the DFSS webinar can shed some light on exactly what their response was to it. I unfortunately wasn't able to make it last week, but from the conversations that I know about, I think the thinking is that from anywhere except for at a hospital or a police station, they can call 311. So there is no identified place where people can go to make that call, unfortunately. So as much as of an answer that is, that's what we know. Yeah, I know, and Leo says, yeah, when you call 311, I mean, 311 has been extremely overwhelmed, as has the Homeless Prevention Call Center. I like what the Homeless Prevention Call Center is doing to try to inform people about the wait times as much as possible. Say, you know, you'll be able to access assistance later. It's not urgent. Call us back at this date and time. So it's a really, really tough time right now. So Ruth, the DFSS webinars are only specific and allowed, the only people that are allowed to attend are DFSS delegate agencies. So that's why we try to attend and then share information as we're hearing it. But most of what they are able to say is in that shelter guidance that is on CDPH's website. So it's chicago.gov/coronavirus, and then there's a resources section, and then there's a resource specifically for shelters. I don't know if there's been public resource available about how people are accessing the new shelters. Okay. So what we will do is take some of this information, especially the piece about how people are accessing the new shelters, and share that with our partners at DFSS and see if there's anything that we can do to bring back to this group some more clarity. And I know they're working obviously as hard as they can to fix this, and as you all know, and I've seen in your own agencies how difficult it is to pivot and sort of address the immediate needs, and you're all doing an amazing job at it. I feel like, you know, at All Chicago and DFSS, we're feeling the exact same way. And so DFSS specifically asked us to provide any concerns or questions directly to them so that they can, you know, help address those as much as they can. And so we will certainly do that. So what we will do now is, I love the chatter that's going on in the chat box, and we'll certainly leave the chat box open for at least another 6 minutes. But Melanie, am I wrong? There's no other questions that it seems like All Chicago staff would be able to address that we haven't already. Does that seem right?
Yeah, that's about it. I mean, there's one about placing clients at the Y when the shelter exceeds capacity, but I'm not sure if we would know that.
Yeah, I think we don't, but that's another one we can either, you know, take to DFSS. And I also encourage anybody, especially those that are delegate agencies, to be communicating your concerns up within your agency so that they come also from your agency directly to DFSS. I think the more, it's with anything, you know, the more times we ask a question, it becomes a priority. So we hold ourselves to that same standard too. So continue asking us the things that you feel like you need to know about, and that'll guide what we're able to do for you as well.
Okay, there is another question. Is All Chicago still releasing a guide for best practices in telecase management for providers?
Karen, is that still on our list of priority areas? Are we going to talk to the PSH providers about that on Thursday?
Yeah, that was my plan, is to talk about that as part of the Thursday call and get people's thoughts or resources of best practice. I know some people have already sent stuff to us, but just kind of help with coalescing that and getting it out. Yeah, for sure. I think it's also a topic people want to definitely talk about, and so I was anticipating creating space for that in probably next week's call.
Great. Okay, Denise, why don't you flip forward a couple slides to the next steps? So you'll see here that our webinar summaries are posted on our website, and so if you need to refer back to something, we will try to post those usually within a day or two. And our webinar videos are also on there if you want to forward this to anybody. And then we'll do our best to communicate the questions that we're not able to answer to DFSS and bring back more information to our weekly webinar that we'll have next week. Please put any other thoughts or questions or suggestions in the chat box about how All Chicago can be helpful, how we can improve, how we can do better in continuing to be a partner with you all during this extremely difficult time. We are open to all suggestions, and we're trying to limit sending out another survey about how else we can be helpful. We may end up doing that at some point. We know you're over-surveyed, but to the extent you can just put in the chat box anything that you think we should be doing for you, we would be really appreciative of that. Thank you all so much for joining, and we'll send out information about next week's webinar, but we plan on holding it again at the same time. Thanks, everyone. Have a good day.